doctoral dissertation committee. But I know him recently, and I asked him for a bio in order to introduce him, and I learned many things about him. So I hope that you all are equally sort of impressed and surprised by his really cool background. So Phirom has a PharmD degree from the University of Health Sciences in Cambodia. After he finished that, he won a scholarship to attend the Agence Universitaire de la Francophonie in France, where he got a master's degree at MS in chemistry. Following that, he went back to Cambodia and started teaching toxicology and analytical chemistry at the University of Health Sciences. It's the oldest government-run health science school in Cambodia. And simultaneous with that, he was working as a hospital pharmacist at a referral hospital. Since then, so since 2013, he's been the deputy head of drugs and food safety of the Department of Health in a province in Cambodia, where his responsibilities include managing, supervising, and following up the rational distribution of drugs, medical equipment, and reagents for hospitals and health centers in the province, and also interfacing with the private sector, so ensuring governance and regulation on private pharmacies and food establishments, basically to ensure that consumers have access to safe medical and food supplies. Super interesting. And also he works on food outbreak investigations, which is just fascinating. And what wasn't in his bio, but what he will be talking to you about today, is he also has a PhD from UCLA in our Department of Epidemiology in the School of Public Health. And he recently finished, defended his doctoral dissertation. We're very proud of him. So I am really excited to hear him talk about his doctoral work today. When I invited him to give this talk, or when we were brainstorming people to give talks, I immediately thought of inviting him because his work and his path is just a great example of sort of the winding road that research can take, particularly in the global health context. So I thought it would be interesting and different from some of the other talks that you've heard. And also, since he just recently completed his dissertation, it's fresh on his mind. And he was also essentially a junior investigator when he was working on his dissertation, despite all of his experience and many years of working in the pharmacy space. This sort of doing public health research like this was new to him. So I thought it would be a great kind of experience and relatable experience for the STTP students to hear. So with that, I will turn off my microphone and turn it over to Phirom. Thank you so much for joining us today.
Okay, hello everyone. Thank you for being here. And I know it is quite early morning in Los Angeles. And first of all, I'd like to express my sincere thanks to Dr. Corina Mushurot for your kind introduction. Okay, so today I'm gonna share my dissertation research experience, but I won't go too technical. Since Dr. Mushurot has already given an introduction of me, I will skip chapter 1. I'm gonna start with chapter 2, followed by the reasons I focused on pregnant women and their male partners, objectives and project implementation. I'm gonna end with some key findings, challenges, and lessons learned. Okay, so I'm gonna skip this. Okay. I mean here. During my time in both pharmacy schools in Cambodia and France, I spent long hours performing chemical analysis, writing reports, etc. And after my master's degree, I realized that pharmaceutical research would not be my ideal professional pathway, mainly due to two factors: a lack of government funding in life science research and a lack of cutting-edge pharmaceutical companies in the country. Therefore, I was thinking of switching to public health, hoping that I would be able to continue to do research and make immediate community impact. But to be honest with you, at the time I had no idea what public health was about and whether it would suit my personality. Therefore, I enrolled in a vacant MPH program at the National Institute of Public Health. It is the first public health school in Cambodia, and it was founded by a UCLA alumni. And as part of the MPH program, we traveled to rural communities to, to conduct surveys and educate people to reduce or quit risky behaviors such as smoking, drinking alcohol, and so on. And compared to working in the lab alone all day, all week, or all year, I found myself more useful and needed when I was engaged with people in the communities. And as you can see in the pictures, people were quite happy to see us. And this is something you don't see in a lab. Uh, and this was how my PhD journey began. I count myself lucky because at the end of my MPH program, Dr. Pamina Gogbak at UCLA, just her, and Dr. Vongthana Sapon at the University of Health Sciences in Cambodia had just obtained a training grant from the NIH Fogarty International Center. And the main objective of the grant was to provide world-class doctoral and master's degrees and doctoral and postdoctoral training to Cambodian public health professionals from Cambodia at UCLA. I applied for a PhD scholarship and got selected. And, and both of them became my main and co-advisors throughout the journey. Uh, uh, After finishing all the coursework requirements and passing a written qualifying exam, I proposed a topic, uh, a dissertation topic, HIV self-testing in Cambodia, users and providers, those experiences in an open label pilot randomized control trial. One and I successfully defended my proposal and then fly back from the US to Cambodia to start the research. Once in Cambodia, I started working on two separate IOB applications. One was for the UCLA IOB, and the other was for the Cambodian IOB. While still working on the time-consuming applications, I was informed of a suspension by the Cambodian IOB of any ongoing or future studies that would involve HIV self-testing. And if I recall it correctly, at the time there was already an ongoing feasibility study on HIV self-testing conducted by an NGO and its partners. And based on, on unofficial sources, one of the study participants reportedly had a serious adverse event associated with the use of an HIV self-test kit. I, and to be honest, I don't know exactly what happened as the information was confidential. And such suspension was unexpected to me and beyond my control. And it was a perfect example of expect the unexpected. And after having a discussion with my main and co-advisors, I ended up changing the topic as we did not know when the suspension would be lifted. And the new topic consisted of 3 studies. Study 1, factors associated with HIV testing among ANC attending pregnant women, secondary data analysis using Cambodia DHA surveys, and study 2, factors associated with HIV testing among ANC attending male partners in Cambodia, a case control study, and study 3, perspectives on male ANC attendance, home-based HIV testing, HIV self-testing by male partners of pregnant women. It was a qualitative research. Then I submitted a new study protocol to all of all of my doctoral committee members for review and approval before proceeding. And of course, it was approved. Oops. Okay. And according to the current Cambodian PMT3 guidelines, both ANC attending pregnant women and their male partners should be offered voluntary and confidential testing for HIV and syphilis as part of routine attended ANC. And a mother's class or couple or individual pre-test counseling should be offered. And official PMT3 data showed that between 2017 and 2020, about 90% of women who did not know the HIV status during their first ANC visit at government-run facilities received HIV testing, and this was below the intended target of 95%. Therefore, this was what my study one was going to look into. And interestingly, only less than 1/4 of their male partners were tested for HIV. However, the current national PMT3 reporting system does not capture two important indicators. One, the total number of men who attend ANC visits with their pregnant partners. Two, the total number of ANC attending male partners. Yeah. Who declined an HIV test offer after pretest counseling. And since the two numbers are not known, the low HIV testing rate among male partners can be explained by one or more scenarios. One, a large proportion of men did not attend ANC with their pregnant partners. And this was going to be this was the focus of my study 3. And two, of the men who attended ANC with their pregnant partners, a large proportion was not offered an HIV test. If some ANC providers did not consider them a priority group for HIV testing, but this was beyond the scope of the research. And three, a large proportion of ANC attending men were offered an HIV test, but declined to be tested for whatever reasons, and this was the focus of my study 3. The main aim of my first study was to conduct a secondary data analysis using Cambodia DHS data to identify individual factors associated with HIV testing during ANC visits among pregnant women. DHS surveys are large, nationally representative cross-sectional household surveys with multi-level cluster design. The surveys are generally done once every 5 years, but only in developing countries. All the data sets are completely free of charge. What you need to do is to create an account and submit a request for any data set you want. And the data is of high quality. But now the question is, does the use of any DHS data require IOB review and approval? Well, and at the time, I was not so sure if the use of Cambodia DHS dataset for my dissertation would require IOB review and approval. So for peace of mind, I submitted my application to the UCLA IOB anyway, and this was their response. So I'm assuming that, based on the response, I'm assuming that the use of any DHS data sets would not require the IOB review or an approval because they are publicly available and de-identified. In study 2, I conducted a case control study to identify factors associated with HIV testing among ANC attending male partners in Cambodia. 132 HIV testing decliners and 264 acceptors were recruited from three government-run ANC facilities in Phnom Penh: the National Maternal and Child Health Center, Chatmok Referral Hospital, Post-Entry Hospital, and this is Phnom Penh, the capital city of Cambodia. In study 3, a qualitative study was nested within the parent case control study. And the study population here consisted of 30 men. All participants were recruited using consecutive sampling from ANC and postpartum departments of the National Maternal and Child Health Center. So here I'm only presenting some key findings. In study 1, 4 factors were associated with HIV testing among ANC attending pregnant women, such as education, area of residence, household wealth, and the quality of HIV pretest counseling during ANC. And among male partners in study 2, HIV testing was predicted by an intention to test, and the intention to test was predicted by 3 factors: the subjective norm, partner communication, and perceived risk of HIV infection.
Did Phirom?
Among men,
Phirom, we're having problems. I think your internet is breaking up.
So
but now you sound better. Now you sound great.
Okay.
Welcome back.
Okay, thank you. Okay, so also again, the barriers to attending ANC among men included being unable to take time off work, waiting outside of health facility, watching over an older child, not wanting to pay for parking fee, a negative community male ANC attendance, a negative attitude ANC attendance, and not being invited by providers to come inside the ANC consultation room. And perceived concerns about home-based HIV testing include worries that neighbors would be suspicious, not being home at the time of the visit, feeling coerced into testing, an inability to verify the identity of the testing team, and the potential confidentiality breaches by the testing team, feeling offended by a home visit, improper or poor management of biological specimens, and the potential for contamination of testing instruments. Most men came up with one or more perceived concerns about HIV self-testing, such as a lack of pre and post test counseling, that may lead to an increased chance of developing depression, committing suicide, or harming others. A reduced chance of disclosing test results to one's partner, a reduced chance of being linked to care, questionable reliability or accuracy of the test kit, instructions of use potentially in foreign languages like in French or English, and a lack of experience using the kit. In terms of free of charge, pregnant women delivered HIV self-test option, the man would question why the provider or his partner wanted him to be tested for HIV, and they would also have a fear of self-testing. And men identify factors that may prevent them from purchasing the kits at the community pharmacies, such as cost, feeling shy or embarrassed when purchasing a kit, low availability, a potential lack of technical assistance from pharmacy staff, and no official test result slip. And also asked to select four testing options in the hypothetical event that their female partners became pregnant again in the future. And the four options were free of charge ANC-based testing, free of charge home-based testing, free of charge pregnant women delivered HIV self-test, and out-of-pocket community pharmacy delivered HIV self-test. 2/3 of the men said that they would choose free of charge ANC-based testing, and if for home-based testing, if it were to be made available in the future, 4 men would opt for it, and 6 men said that they would go with HIV self-testing, and if it was a possibility in the future. I mean, specifically, 3 men would be interested in the pregnant women delivered HIV testing self-testing option, and the remaining 3 would prefer to purchase a kit from a community pharmacy. At the end of the interview, of each interview, also the men were asked to suggest potential strategies that could be implemented by health authorities to increase HIV testing coverage among male partners of pregnant women, and approximately 1/3 of the men could not think of any. And among those who could, a wide range of were brought up. One, use mass media to increase community awareness about the benefits of male HIV testing during their partner's pregnancy. 2, make male partner testing during ANC visit mandatory. 3, set up community-based or mobile-based testing venues. And 4, provide HIV testing and counseling services on Sundays. And 5, provide HIV pre-test counseling to all ANC attending male partners. And last one, use IEC materials, for example, posters or flyers at ANC facilities. These were the challenges I have encountered during my day recollection. One, it was not surprising that a lot of potential study participants did not know much about participation in research. To deal with that, the ANC providers and the interviewers had been adequately trained before the fieldwork, and the role of the provider was to initiate contact with the potential research participants. And the interviewers were responsible for providing the participants with the detail of the study. And in Cambodia, in Cambodia, government employees received a low salary, typically less than $500 a month. This means that being involved in an uncompensated research project would represent additional work burden for them. So I have instructed my interviewers, who were stationed at each participating ANC facility to give the providers a hand with basic or non-technical work whenever possible. Moreover, giving light refreshments like once a week or every 2 weeks made them feel much appreciated. And although each although each participating health facility did try their best to accommodate my team. At times, the assigned private interview room was busy. So the team had to be flexible, meaning we had to be ready to temporarily move to another private room nearby or another floor. And four, due to limited research funding, I was not able to recruit professional interviewers and transcribers. As a result, I ended up recruiting senior public health students from the University of Health Sciences. All of them already had formal training and experiences in collecting quantitative and qualitative data and doing transcription. And before the field work, they were provided with additional training and detailed information about the study protocol. And when doing research in Cambodia, being able to speak the local language is not a must. However, knowing a couple of commonly used Cambodian words or phrases would be appreciated by your local study team members and also study participants. Okay, and I was extremely lucky to have received quite strong administrative, technical, and logistical support from the University of Health Sciences in Cambodia. I mean, all of them are in Cambodia. The National Maternal and Child Health Center, the National Prevention of Mother-to-Child Transmission Program, the National Center for HIV, Dermatology, and STDs, and the HIV/AIDS program of Phnom Penh Municipal Health Department. Okay, and I have ended my presentation. I mean, if you have any question, we can. I mean, we can talk and discuss them. Okay, so thank you so much for your attention.
Thanks, Phirom. Excuse me. It was great to go on that journey again of your evolving dissertation research.
Yeah.
Talk
Yeah.
about making the best of a really hard situation.
Yeah.
I think you can stop sharing your screen. That might be easiest.
Okay. Not stop share. Okay.
There we go. Great. Does anyone have any questions? Any students have any questions?
Yeah. No. Oh, never.
I was glad to hear you put in a plug for DHS datasets. This is something we don't talk that much about in the STTP series, but there are really amazing secondary data sources available, including DHS. And they're, I mean, as Phirom mentioned, like they're super high quality. They're collected with fairly frequent regularity, and they're done in lots of different low and middle income countries. So they use standardized questionnaires, which means you can combine countries into a single analysis. They're really amazing, and they're freely available, where free is both the monetary. So, it doesn't cost you any money. And as long as you have an account, you can place a request. Anyone in the world can place a request for the data. Some of them have GIS information, so you could do like geographic linkages with other data sets. I mean, they're really, really amazing. So thanks for putting in a plug for using DHS data.
Yeah. Yeah. So, okay. So does anyone have any question about my research or whatever, I mean, in Cambodia?
I have a question. Thank you so much for the presentation. A lot of the students that we're working with are doing research in countries where they have not spent a lot of time and where they're more outsiders. So doing global health research as an American student in Cambodia, is there any advice that you would give them and their approach to working with different organizations in Cambodia based on things that you've seen people do right or they've not done well when working in another country? Obviously, you had the more insider approach.
I mean, in the past, there have been American students, I mean, they're from UCLA and from other countries coming to Cambodia, like to the University of Health Sciences. And at the National Institute of Public Health, and also some NGOs, some local, especially local NGOs. And when, I mean, when they came to Cambodia, usually they were assigned like local advisor. So I mean, they had one advisor in the US and one advisor in Cambodia. And so to me, I think the key to do to have a successful like internship or research in Cambodia, I mean, it's all about collaboration between the two institutions and between your two advisors. I mean, when you come to Cambodia, if you have a local advisor, and you should be okay, you should be fine. There should not be any problem. And usually, I mean, if you come to big institutions like just mentioned, like the University of Health Sciences or Institute of Public Health or whatever, or NGOs, people speak English. So you should not worry too much about the language. But if you go to the rural communities, you should at least know a couple of words, and I think that's it.
Yeah, that's an important point as well. That's the importance of learning at least a few words in the local language. It probably goes a long way in establishing relationships with people.
That's true. And thank you for your question.
Mm-hmm.
Yeah.
Any questions from the students? They're all very busy working on their own summer research at breakneck speed. They're in the final stages of the summer research portion, and they're working on preparing an abstract and a poster that they will be presenting next Friday on their research.
Yeah, that's soon. That is coming soon.
Yes, coming soon.
Yeah. Okay.
I had a question. I know I'm not a student, but just yesterday we discussed qualitative data analysis. And I was wondering if you could talk a little bit about, working in like multi-language data. We talked about when you're doing analysis, the need to translate into English if you're an English language speaker. But I was curious if you sort of had any thoughts about working, especially on global teams where people might speak multiple languages, might be coming from, different places, just your experiences working on analysis and sort of like the role of language, particularly thinking about qualitative work, I guess.
Okay. Thank you so much for your question. Actually, when I did my dissertation research, I did not have any international team members, so I did not have any problem with the language. But actually, I wanted to translate all the transcripts into English, so that translating a lot of documents from the local language, from Cambodian language to English would cost a lot of money. So in the end, I decided to just transcribe the audio, the audio into transcripts, but all of them were in local language, not in English, because because I was the person who did the analysis.
Mm-hmm.
Yeah, so I did not have any problem. I did not have any need to translate all the transcripts into English.
Yep.
Yeah, but like you said, I mean, if you are working in an international team, and a lot of them will be involved uh, in analysis in the analysis of the qualitative data. Yes, you must translate all the transcript into English, and then it would cost a lot of money. You know? I mean,
Yes.
you need to have a budget for that.
Yeah.
Yeah. Yeah. Okay. Thank you so much for your question.
Yeah. Thanks for answering it.
Yeah.
I have another question, but I want to make sure that the students have an opportunity before I ask a second one.
Yeah.
Anybody? So I wanted to ask a question about your approach to publication. You know, you're doing this really important research in Cambodia, and obviously for the purpose of your dissertation, it was with a U.S. institution, and you know the dissertation is written in English, and you know there will probably be a certain number of publications to English-speaking journals. But do you where do you usually share this work? Is it mainly in English-speaking journals? Are there journals in Cambodia? I'm assuming you're a French speaker as well. Based on your time spent in France, and I know they have journals as well. Like, what is your approach to kind of sharing your research and publication?
Oh yeah. Okay. That is really important. Yeah. I'm actually in Cambodia. There is one a newly established, newly formed a public health journal. But yeah. But usually. Oh, can you hear me? The connection is unstable. Actually, I mean, my advice, my advisor, I mean, my committee and I have been working on on the manuscripts, and we are going to. I mean, we plan to submit them to international journals. I mean, I mean, they are in English. Yeah, and we haven't finished them yet. Yeah, but I mean, we play, yeah, and hopefully we can. I mean, we can submit them soon. Yeah. Yeah. Did I answer your question?
Yeah, I always think about how complicated that would be, because you know to publish in international journals, you're always having to publish and write in another language.
Oh.
It's just another layer of challenge, I think.
Oh yeah.
Yeah.
Yeah. That's right. Yeah. Yeah, that's true. But but when I'm going to publish, I mean, I won't do it alone. I mean, I will have my advisor, co-advisors, and all committee members. So I mean, yeah. So I will get a lot of. I mean, I have already received a lot of feedback from them. So yeah. So it should be a little bit easier. No, not a little bit, but much easier than doing it alone. Yeah. Especially English is not my first language. So yeah. So yeah.
Well, best of luck with getting that work out there.
Oh, thank you so much.
Yeah.
Yeah. So we still have like 15 minutes left.
I know.
Yeah, because I finished a little bit early.
Yeah, I mean, if students don't have questions, we could definitely give you back 15 minutes of your evening. So I'll do one last call for any questions. Anybody? Okay, well, thank you so much for presenting. It was great to see you. Sorry about the internet difficulties, but glad we overcame them. It was really interesting to hear about your work and have you reflect a bit on your journey. So thank you very, very much.
Thank you so much. Best of luck. Stay in touch.
There's a question coming. Oh, no.
Oh, just a thank you.
Yeah, thanks. Oh, that's fine then. That's fine then. The students are busy, so that's fine.
Yeah. Well, thank you very
Okay.
much. Nice to see everyone.